If you're joining my life, you're welcome. So I'm talking about ectopic pregnancy. For those of you that don't know what an ectopic pregnancy is, I don't know if I'm loud enough. Ectopic pregnancy happens when a fertilized egg implants outside the womb. You understand? Normally when an egg is fertilized, it is meant to implant inside the womb. Fertilization does not take place inside the womb, but when the ovary is released, then the sperm, after intercourse, the sperm travels through the womb. Then fertilization occurs in the tube, in the fallopian tubes, where it is transported into the womb for implantation. Now, what happens in an ectopic pregnancy? In an ectopic pregnancy, the implantation does not implant inside the womb. It implants outside the womb. 90% of ectopic pregnancies, implantation happens at the tube. In some cases, in some rare cases, it can happen in the abdominal cavities, your liver, your abdomen, your cervix. In rare cases, in the ovaries, rare cases in the ovaries. But 99% of times, ectopic pregnancy occurs in the tube. So that's why sometimes it's called the two-pair pregnancy. Ectopic pregnancy is one of the, please, if you are joining my life, don't just go like that. Do well to subscribe. I make health content here. Ectopic pregnancy is one of the, let's say, the most life-threatening pregnancy when it comes to pregnancy complications to we women. You understand? It's one of the most, in fact, yearly women normally die of this ectopic pregnancy. I know of someone that died of ectopic pregnancy just last year. And one thing about it is that you don't know. It has normal symptoms like normal pregnancy. You miss your period, you test positive, but later on you might start feeling abdominal pain, particularly maybe the right side of your this thing, your abdomen, or maybe your left side of your pelvic region. So one of the things that makes it more life-threatening is that when implantation happens, the baby will grow now. You understand? The baby will grow. So the tube, our tube, the fallopian tube, is not designed to accommodate the growth of a baby. Some persons mistake ectopic pregnancy with cystic pregnancy. That is not the same. They confuse all these things. They are not the same. Ectopic pregnancy is a growth that happens outside the womb. I've heard of some cases where a baby grows outside the womb and the baby survive. Is a rare case. Medically, it's not possible for a baby to grow outside the womb and also you carry it to full term and you give birth to the baby. No, 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 no. Like, there's no logical explanation that such kind of baby can survive, because one, the baby needs placenta, and that placenta delivers oxygen to the baby, nutrients to the baby. So in an ectopic pregnancy, where would the baby get its nutrient from? Where would the baby get all those stuff from? So it's kind of rare, but I've heard of such kind of case where a baby was, was carried to full term outside the womb, but medically it is not possible. Medically is not possible. Please, if you are joining my life, you're welcome. Do well to subscribe. So ectopic pregnancy is kind of life-threatening to us women, and one thing about it is that it's something that you do not plan for. It can happen to anybody, no matter how careful you are. It can happen to anyone. Understand? And one thing that makes it more life-threatening is that when the baby is growing and the tube is not designed to contain a baby, it will be expanding. It will be expanding, and once it ruptures, internal bleeding, all those things can put the mother's life at risk. That's why when you go to hospital and maybe they run a scan on you, maybe confirm that you are pregnant and they run a scan on you and they do not see any baby in the womb, maybe any sacs, immediately they check for ectopic pregnancy. They check your tubes, If it's there, they check your abdomen. If the baby is there, and if maybe they confirm immediately that the baby is in your tubes, you are going for immediate surgery to remove it. Because if you don't remove it, the mother's life is at risk. It's not something you can manage and say, yeah, I know now, by faith, all those things. I know there's a place for faith for those of you that believe in God's miracles work. I'm not disputing that. But once the doctor discovered that you have an ectopic pregnancy, the next thing is surgery. It's not negotiable. It's surgery to remove it, because if that thing is here, you can die as a mom. You understand? It can put your life at risk. It's something that most women don't survive, particularly if it's not taken immediately. If the emergency is not taken immediately, it's something that most women don't survive. So you might be wondering, what causes ectopic pregnancy? Why is it that some women end up having ectopic pregnancy? Well, if you ask me, one of the causes of ectopic pregnancy is PID, that's pelvic inflammatory disease. Not all have followed and enjoy your content. Thank you so much. Thank you so much. I appreciate Miracle or the Chi. I don't know if I got the other this thing. Okay, thank you so much. So one of the major cause of ectopic pregnancy is PID, pelvic inflammatory disease, and sexually transmitted infection. You have to know the difference between these two. PID does not mean that it is sexually transmitted. That's what some persons don't know. In fact, I wanted to connect with you but couldn't find your contact. Okay, you want to connect with me like WhatsApp? Is it what you meant? Okay, I don't know. Should I drop my number? Just let me know if you want my contact. Okay. So as I was talking, um ectopic pregnancy, one of the major causes PID and sexually transmitted disease. Some persons mistake these two. PID. Once they hear PID, they think that then they got it from sex. That's not true. Okay, WhatsApp. Okay, let me just. Are you ready now? Let me just call the number. Okay, 070. I'm not supposed to call my number here. I don't know. Can I DM you? But there's no way. I don't want to call my number here. I don't know how to reach out to you because here is a public space. But let me just call my number just for you. 070 14 33 7854. That's my WhatsApp line. I don't know if you get it. So as I was talking about PID and sexual. Okay, you're welcome. So as I was talking about PID and sexually transmitted infections, some persons mistake these two. They are not the same. Like staphylococcus, all these staph infections. Staph infection is classified as PID. You know, when you do your this high vaginal swab test, you are welcome. You're welcome. Yeah, we are welcome. So if you have something like staph, yeast infection, all those things are classified as PID, under PID, pelvic inflammatory disease. You understand? And you can get yeast infection without even sleeping. Like, it's not sexually transmitted. Like yeast infection, you can have it without even being sexually active. I don't know if you get my point. You can have yeast infection without being sexually active. So it can be that your normal flora, remember that the vagina has a like say a normal flora. Normal flora, like, is like the bacteria, the good bacteria that helps to protect the normal pH of the vagina, because our vagina has good bacteria like down there. So yeast infection occurs when that normal flora is not balanced. Maybe it's overgrown, or maybe the bad ones overtake the good ones. I don't know how to break it down, but just take it that way, that yeast infection occurs when the normal flora of our VJ is not well balanced, the pH is not well balanced, it can cause that yeast infection to grow. And this can happen through misuse of antibiotics. Yes, when you use too much of antibiotics, you are killing your normal flora down there, your normal pH in your vagina. Misuse of antibiotics can cause harm to you. You understand? Can cause harm to you. That's why some persons, they treat yeast infection every time, but the infection keeps reoccurring. This is one of the reasons why. It's not all about taking antibiotic. It's also about taking the right antibiotic and don't abuse it. So pelvic inflammatory disease can cause um ectopic pregnancy, particularly when it's left untreated. And when it comes to sexually transmitted disease, the two major ones that causes ectopic pregnancy is gonorrhea and chlamydia. In fact, you see chlamydia, this is one of the worst, let's say one of the worst sexually transmitted disease that causes ectopic pregnancy for women. One thing about this type of let's say disease, chlamydia, is that it hardly shows symptoms. It can be on your body for years without you having symptoms. That's how dangerous it is. You understand? That's how dangerous it is. That's why you should have like say you should have a trusted partner that doesn't sleep around, because sleeping around, if you have a partner that sleeps around as a woman, it puts you on a high risk of having these issues. I've heard of a story of a lady that I think she was married as a virgin, and she was looking for children for years. Unknown to her that her husband was promiscuous and with having contact outside. Unknown to her, she contacted this chlamydia. And one thing about chlamydia is that the symptoms can be in your body for years and without you knowing. And one thing that it does is that it causes scar tissues in your tubes, your fallopian tubes. I don't know how to explain this. Now, scar tissues, now your fallopian tube is supposed to be smooth. You understand? It's supposed to be smooth so that the fertilized egg can move freely and implant into the womb. So now when you have this type of infection, sexually transmitted infection, PID, all those kind of stuff, it causes those bacteria causes scar tissues in your fallopian tubes. I don't know if I'm explaining this thing in the right way you understand. It causes scar tissues in your fallopian tubes. Scar tissue is like this is something that is not supposed to cause friction, like it's not supposed to it's supposed to move freely, but scar tissue is like it causes friction, like something hold up or breaks. So when that happens, the thing cannot move freely again and end up implanting in the tubes. So this is what all this sexually transmitted disease, PID, does to your tube, which can result to ectopic pregnancy. And one more thing you have to understand is that it's not all women that has ectopic pregnancy that have PID or chlamydia or gonorrhea. No, it's not like that. Sometimes the cause is unknown. You heard me. Sometimes the cause is unknown. It's something that can happen to anyone, anytime. It must not be that it must have PID before you have what they call it, ectopic pregnancy. You must have chlamydia before. But this is one of the reasons, you understand, like science will tell you, this is one of the reasons that can contribute to you developing or having ectopic pregnancy. That's why, as a lady, if you have anything like infection in your body, don't take it lightly. Whether it's yeast infection, all those things fall under PID. Some women think that, hey, since I'm not sexually active, that there's no need of me going to run a test to know my head stature sexually, or maybe to go and run infection test. Sis, it's not so. It's not so. This is one of the misconceptions some women have, that since you are not sexually active, there's no need for you to go and do your routine checkup. That is not true. Staff, Staph is not something, in fact, it cannot, is staph infection, that's this staph infection, is not something you get, like, even if you get it sexually, but it's not something you get like when you are sexually active. You can have it without being sexually active. Yeast infection, you can have it without being sexually active. Like I explained before, if your normal flora down there is disrupted, because the vagina has its normal pH that is supposed to keep it protected. When all these good bacteria there, or maybe the bacteria there is overgrown, because our VJ have good bacteria that helps it to function properly. When it's overgrown, this yeast infection, because yeast is one of also the good bacteria we have there that works its own function. But when it's overgrown, that's why when you go to, I don't know, when you go to a lab test, they will say heavy growth, mild growth, so growth, because it's supposed to be in a range. I don't know if you understand all these bacteria, even stuff. For some routine checkups like endocervical screening needs the use of instrument to penetrate. Yes, it does. Yes, it does. But there's a way that you do it. There's a way you do it. See, it takes an experienced doctor. There's a way you do it. You understand? In most cases, in some cases, in fact, the procedure you need to be pen, but I can tell you for sure, I can tell you for sure that you can still get this thing without penetration. Understand? Would you advise someone who is a virgin to do such investigation? Okay, let me explain something you don't understand. I don't really want to go private when it comes to that question, but I want you to chat me up. There's a way you can go about that kind of test without being penetrated. You understand? I would like to share my own story, but just chat me up. You have my WhatsApp line, just chat me up. I will explain to you. You understand? It takes an experienced doctor to run that procedure without penetration. Like now, the doctor will ask you to lie down. This is based on experience. The doctor will ask you to lie down. Then you start coughing, like cough. When you start coughing, it's as if you are forcing something. So now they will now put a little bit on the tip of your this thing. Put it. You don't have to, just chat me up. I will explain to you. So that routine checkup that routine checkup helps to detect all this stuff early. You don't have to allow it to grow until it starts causing issues. That's one thing they don't tell you girls. Even if you're not sexually active, it is advisable for you to go for routine checkups. It's still staph, it's still a yeast, and candida. Yeast is also classified as candida. All those things can cause harm to you when it's left untreated for years. When it's left untreated for years, it can cause scar tissues on your fallopian tubes, and this can result to ectopic pregnancy. When you say routine checkups, how often? Okay, it must not be every time. At least you can do it once in 6 months. You can do it once in 6 months. Once in 6 months is okay. You understand? You can do it once in 6 months. But if you are sexually active, at least once in 3 months. You can run HIV, hepatitis, all those screaming tells, particularly if you are sexually active. You can do it, but if you are not sexually active, at least once in 6 months is okay, or maybe once in a year. You can just do it once in a year. It's not something you do often. And funny enough, all these tests is not expensive as people think they are. It's not expensive as people think they are. So once in a year or once in 6 months is okay. You understand? You just run it and treat yourself, just to rule out anything that will cause issue for you in the future. So this is what people don't understand when it comes to routine checkup and the rest. So if you have any question, you can drop it in the comment section. Our discussion today is about ectopic pregnancy, why it happens, what causes it, um just to rule out some misconception. Is not ectopic pregnancy can actually happen without you having any sexually transmitted disease, without you having PID also. Sometimes the cause is unknown. Sometimes it just happens, the cause is unknown. So that is what it is. I've seen a case that I was going through Facebook one certain time, and I saw a write up where a baby grew to full term outside the womb. What are signs of ectopic pregnancy? Okay, one of the signs of ectopic pregnancy is that pelvic pain, start experiencing pain, maybe particularly at the left side of your tubes, or maybe at the right side of your tubes, when the pain is very cruciating. You understand? A severe pain. Something like this ectopic pregnancy, the sign is not like I say, before it starts happening that way, it acts like a normal pregnancy, because sometimes you miss your period. Normal pregnancy, of course, you miss your period, you will test positive, like your normal positive test is when the pregnancy starts growing, when the baby start getting enlarged and the tube cannot contain it. That is when you notice that one side of your pelvic region, or maybe your tubes region, is having severe pain. If you're observant enough, once you start having such kind of pain that is very cruciating or whatever, you rush down to the hospital for scan. And the best way to detect this type of pregnancy is through scan. That's just the truth. To detect it early is through scan, this transvaginal scan. That's why a lady is advisable, at least from 5 weeks of pregnancy, just go for scan. Let them know what is really there. Like, particularly if you have this history of ectopic pregnancy, maybe if you have experienced it before, you don't wait till the 12th week or 8 weeks before the start having heartbeats. You understand? So the best way to detect it early, before it starts even experiencing pain, because before you start experiencing pain, that means the baby is getting large and the rest. The best way to detect it early is to go for scan. Scan can detect it if something is growing outside the womb, because from 4 weeks, from 2 weeks, but let me just use the word 4 weeks. From 4 weeks, there's supposed to be a sign of pregnancy in your uterus. At least the sac is supposed to be there. You understand? That sac is supposed to be there. What will be done if detected? That's a nice question. Thank you. Now, if you go for a scan, maybe 8 weeks, maybe 5 weeks, and they detect that you have ectopic pregnancy, it is surgery immediately, because it's life-threatening. It's not something you just joke with. It's not something that they will tell you to go home and come back. No, they are giving you hospital bed immediately and operating you, taking that stuff out. And in some cases, some women will even lose their tubes. Many women lose their tubes during such kind of surgeries. You understand? Yes, surgery, they will operate you immediately, undergo surgery immediately once they detect that you have an ectopic pregnancy. Because if they don't do it, and that pregnancy is there till 8 weeks, 12 weeks, it will rupture. It will burst. The tube will burst, because the tube is not designed to harbor the growth of baby. It will burst, and once it's burst, you see the bleeding, internal bleeding, and that thing can be life-threatening. It's something that, in fact, it's something that can kill kill women. Like, it's like most women lose their life during this process. They lose their life during this process. Men that have that has experienced ectopic pregnancy, sometimes they are scared of getting pregnant again. I'm telling you, the emotional trauma of the past experience they had, they are scared of getting pregnant again. Because imagine that you are pregnant and they discover it's an ectopic pregnancy. You undergo surgery. Maybe if God show you mercy, you do not lose that tube, because we have two fallopian tube, one on the right, one on the left. If God shows you mercy, you do not lose that tube. And maybe the doctor tells you that you have only one tube remaining. Okay, maybe, okay, in the process maybe you lose that tube, and maybe the doctor then tells you that is only one tube remaining. You be scared now to get pregnant because what of the next one you are getting pregnant again and result to another ectopic pregnancy? That means you will be left with no tube if maybe the surgery wasn't successful enough to save that tube. So it's very, very devastating. Like I feel so bad for women that have to experience such kind of thing, ectopic pregnancy. Women go through a lot. We women go through. I don't know why we deserve such kind of thing. We go through a lot. We go through it. And someone will say, it's because of your promiscuous, because of your sleeping around, it's because of this, because of that. It's not always like that. It's not always like that. It can even a woman that is a virgin and just meets a man, maybe your husband, you can still have all those kind of issues. It's not always sleeping around. That's why it is good as a lady, just go for a routine checkup so the futures can be preserved. No, now the baby cannot survive. It cannot survive. How will the baby survive when the organs is still developing now, so it cannot survive. Some of the organs is not even there. So at 5 weeks, at 5 weeks there is no heartbeat yet. At 5 weeks of pregnancy there is no heartbeat yet, so all those part of the body is still trying to like say develop properly, so the baby will not survive. Although I've heard in some cases where um a woman carried a baby to full term in an ectopic pregnancy and gave birth. They operated the baby, and there was a, like what I saw on Facebook, was it just last week? I saw where a woman was giving testimony that the her baby grew outside the womb. That's an ectopic pregnancy, grew outside the womb, and she delivered the baby. I saw the baby, everything complete. I was like, how possible is this? That it was, the baby was found in the abdominal cavity, that's around your liver region, your stomach region. That's where the baby grew. Like I was it's kind of mysterious, but there's nothing God cannot do, but medically it's not possible, because where will the baby survive? Yes, it's miracle. Miracle happens. Miracle is something that is beyond human explanation, is beyond science. Science cannot actually explain why such kind of thing happens. That is why it is called miracle. But when it comes to medically, it is not possible. It is not possible. There's no way a baby can be carried to full term, like you deliver the baby and the baby is okay, alive in an ectopic pregnancy. It is not possible. It's not possible. I've not heard of it, but um it happens. You understand? I've heard of where a woman carried baby and the baby grew outside the womb, maybe hide, and later gave birth. I've heard of it. So that's it. For pelvic inflammatory disease, I just want you to know, if you're a lady watching me on this live and this thing, you don't have to be sexually active for you to have pelvic inflammatory disease. This is what they don't really teach women about, particularly our sisters. Those are sisters that keeps to the faith, all those stuff. You don't have to be sexually active before you have pelvic inflammatory disease. What are the common causes of ectopic pregnancy? That is what I've been explaining here. One of the causes is pelvic inflammatory disease. We have sexually transmitted infection, something like gonorrhea, chlamydia. All this type of infection is what people take for granted. That's why when you have a partner that is promiscuous as a lady, or maybe you are promiscuous yourself, it exposes you to a lot of things. It exposes you to risk. It exposes you to all kinds of infections that is not supposed to be there, and all these small infection that people downplay. Some person thinks that it's only HIV that they should be scared of. It's only HIV they should protect themselves against when it comes to sleeping around. That is not true. It's only hepatitis when you should be scared of. No. As a woman, as a woman in her childbearing age, There's so many things you should protect yourself against. You see, chlamydia is very, very tricky. It can, in fact, your partner can infect you with chlamydia and can be there for years without symptoms. And this is one of the leading cause of infertility in women because it damages the fallopian tube. It can cause scar tissues there instead of it to move, because once fertilization occurs in the fallopian tubes, not in your womb. The sperm travel through your womb to the fallopian tube while the egg is released from the ovaries. Then they jam there and meet. Then fertilization occurs. Then it transports to your tube, to your womb to implant. That's the uterus to implant. But if there's scar tissues there, scar tissues are just like, will I say, frictions, like something. Let me use this thing as an example now. I don't know if you see all this line. Scar tissues are like all these things. If I'm moving my hand like this, I'll be jamming some of these things. It's not moving freely. So scar tissues are like all those things that disrupt the normal movement. It's supposed to be smooth so that it can implant inside the womb. It's supposed to be smooth, but it's not. Have you seen it? It's not. So all these bacteria goes inside your fallopian tube and cause scar tissues there. And when it happens, when fertilization occurs, instead of this thing to travel and implant inside your womb, it implants inside your tubes. And that is what results to ectopic pregnancy. I don't know if you have any other questions. You can ask me. Any other questions. So that is what happens in an ectopic pregnancy. So it is good for you to go for a routine checkup. It must not be every 3 months. If you are sexually active, you can go for every 3 months, run your routine checkup, HIV, hepatitis, all the rest, high HPV, that's a high vaginal swab test, do all those things, urine MC, all those kind of tests, you understand, just to rule out anything. But at least every once in 6 months, it's advisable for you to go and run tests and know your health status and treat. Funny enough, all this bacterial infection is something that you can easily treat. This chlamydia that causes infertility in women, it doesn't show symptoms. It can stay for years. Chlamydia can be in your body for years without you having any symptoms. At least if you have symptoms of something, at least when you start having symptoms, you go for a checkup and you start treating yourself. You understand? But in this case, is that it hardly shows symptoms. So how will you know? That's where the issue lies. How will you know without running a test? How will you know without normal routine checkup? And when you have chlamydia, in fact, it's one of the leading cause of infertility in women. So you shouldn't be only scared of having HIV when it comes to having your partner, having many partners. You should also be scared of having chlamydia, because this can cause infertility in women. You understand? It can cause infertility in women. And one of the ways to know is just to run tests. And funny enough, chlamydia is something that you can easily treat. It's not a hard infection that will take you, maybe a stubborn infection. It's something you can easily treat. Something like you can easily treat it with metronidazole, so that's flagyl. You can treat it with doxycycline, but I don't prescribe any drugs here. If you want to, for anything treatment, you go to the hospital and meet your doctor. But it's something you can easily treat with just minor antibiotics. That's how tricky it is. You can easily treat it with minor antibiotics. It's not something you spend millions of money treating. No, it's not like that. And since you can treat it with minor stuff, you see how tricky it is. Since you can treat it with minor stuff, if you leave it in your body for years, it causes you issues that can last there forever. So some women don't even survive ectopic pregnancy. It's in some cases surgery. When you undergo such kind of surgery, in the process of removing the baby, the implant baby in your tubes, you might end up losing that tube, and you just have one tube. And you having one tube does not stop you from becoming a mom. Does not stop you. What are the necessary treatment that one can take to avoid having ectopic pregnancy? Okay, I have to get something right. Ectopic pregnancy is not a disease. You understand? It is a pregnancy complications. Ectopic pregnancy is not a disease. It is a pregnancy complication that happens when implantation is supposed to happen in the womb, your uterus, and it occurs in your tubes. It is not a disease. But I'm just explaining, I'm explaining what some of the causes, like what can result to an ectopic pregnancy. So many things can result to ectopic pregnancy. Sometimes you don't even have to do anything for it to even have it. You understand? For it to occur. You understand? So I'm just explaining PID, chlamydia, and gonorrhea. All this stuff can result in scar tissues. You understand? You having chlamydia, you having gonorrhea, yeast, staph does not automatically mean that you have ectopic pregnancy. I don't know if you get me. Don't get me wrong on that. You having all this type of infection does not automatically mean that you must have ectopic pregnancy. No. It's just that it increases chances of having ectopic pregnancy if not treated on time, if not taken care of. So women might even have this and conceive naturally without even having any ectopic pregnancy. You understand? Just that when science tells you that this increases your risk of having this, that does not mean that when you have this, it means that you must have, like, let me explain in another form. Like now, study shows that women that has, let me just give an example so that you get me. Study shows that women that has low vitamin D have higher risks of having fibroid. You can search that up. You can do your research on that. Study shows that women that has low vitamin D, I'm just trying to give an example of my explanation, have higher risks of developing fibroids, because 85% of women that are diagnosed of fibroid are low on vitamin D, in the sense that a study was conducted where 85% of women that have fibroid happens to have low vitamin D level. You understand? Now you ask yourself, does it mean that having low vitamin D as a woman automatically mean that you have fibroid? The answer is no. That's exactly what I'm explaining here when it comes to PID, chlamydia, and gonorrhea. Does it mean that when you have this disease, does it automatically mean, as a woman, does it automatically mean that you have that you must have ectopic pregnancy? The answer is no. Now let's come back to the vitamin D. Now, since they said low vitamin D level increases your risk of having fibroid, and a study was also shown that 85% of women with fibroid have low vitamin D. Then does it mean that every woman that has low vitamin D automatically have fibroid? The answer is no. So when it comes to pelvic inflammatory disease and sexually transmitted infection like chlamydia and gonorrhea, having it does not automatically mean that you will have ectopic pregnancy, but just that having it increases your chance of having ectopic pregnancy. This is because all this kind of infection goes and cause scar tissues in your fallopian tubes. And when this happens, the baby, instead of this implantation to occur in your uterus, it happens in your tubes. This is what results to ectopic pregnancy. This is what results to ectopic pregnancy. I don't know if I've answered your question. You that asked what are the necessary treatment that one can take to avoid having ectopic pregnancy. Ectopic pregnancy is not a disease, like I told you. It's something that happens. It happens like normal way that pregnancy occurs. Your egg and sperm meeting together. You understand? Then implantation happens. So it's not a disease. It's like a complication that happens in the process of fertilization, the process of implantation. It's a complication that happens, not a disease. So there's nothing you can do. There's no treatment you can have. The only treatment you can have is by treating any infection that can result to it, or maybe any sexually transmitted infection you have that can result to it. But I want you to understand this is not the only thing that can cause ectopic pregnancy. Other factors can result to ectopic pregnancy. Even sometimes the cause is even unknown. That's one thing about this stuff. The cause is unknown. So it's not because of you have a promiscuous partner that resulted to ectopic pregnancy. That's not true. You can have a partner that is not sleep around and still have ectopic pregnancy. It's not because you are dating, maybe you have this. So that's why I say sometimes the cause is unknown. It can just happen like that without any factors causing it. So if you have any question also, you can just drop it in the comment section. I will answer you the way I can. So I don't know if you're understanding and you're enjoying my life. If you're coming across my life, do well to subscribe. I make educational health content here. So I make educational health content. So if you are coming across my life, just do it to subscribe. I hope. How can an individual track their reproductive health after experiencing ectopic pregnancy? How can an individual track their reproductive health after experiencing an ectopic pregnancy? Okay, for women that has experienced ectopic pregnancy and maybe in the course of surgery, their tubes were removed. We have two tubes as women. Their tube were removed. You only need one tube for pregnancy to occur. You understand? You don't need the two tube because during ovulation, only one of your tube releases the egg that causes the fertilization and implantation. So you don't need two. It must not need two tube for fertilization or pregnancy. So even with one tube as a lady, you can still conceive. Even with one fallopian tube as a lady, you can still conceive. But just that your chances of conceiving is more limited compared to when you have two. You understand? So for women that has undergone an ectopic pregnancy and they are scared because it's something that once you undergo such kind of surgery and you'll be scared. Now what if I get pregnant again and this other one too I have result to ectopic pregnancy? You can go for IVF if you're scared of maybe going through the natural way of implantation, fertilization, implantation. Another easiest way you can go for is also implantation. Sorry, let me turn off this. Can go for implantation because it's a scary process that a woman should go through, and one of her tube is removed. You'll be scared to get pregnant again through natural way. You'll be scared, what of the other one got loose? Like, what of if maybe that one tube that is remaining, you you don't have it again, maybe or ectopic pregnancy occurs again. So the easiest, will I say, another way to bypass that is for IVF. So the IVF fertilization don't need to go through the fallopian tube. No, they don't need that process. They just collect your egg, collect the sperm, fertilize it, then implant it inside your womb direct. So you don't need to go through ectopic pregnancy, stress, and the rest. So this is for women that have trauma, that has undergone and that have experienced ectopic pregnancy in the past and are scared that what of if maybe they get pregnant again and this one tube that is remaining result to ectopic pregnancy. So another easiest way, will I say, another way you can do it is through IVF if you have the money. I think IVF in some facilities, that one 2.5. Some places is 1 point something. It's kind of expensive though. It's expensive though. But it's quite worth it. And one thing about IVF is that you have multiple choices. Like you have multiple choices of having multiple pregnancies. Like you can have two babies at once, 3 babies at once, 4 babies at once. So that's one of the benefits of IVF. You have more liberty to have more babies compared to the natural way of conception and the rest. So for women that has undergo such kind of thing, if they have the money, for me, I'll advise them to go for IVF. But I don't know, Sha. Everything is just, I'm not a gynecologist. I'm just saying. So IVF is another way to just get the baby implants. How is ectopic pregnancy diagnosed? Okay. Um, ectopic pregnancy is diagnosed through scan. Like when you go for your normal checkup. Of course, you go for your normal checkup as a pregnant woman, and I will advise any lady that is pregnant or maybe that has experienced ectopic pregnancy before. Don't wait till that pregnancy is 12 week. Don't wait till the pregnancy is 10 week. Once it's at least you confirm that you are pregnant, at least 5 weeks of pregnancy, should go for scan. The easiest way, the only way to confirm that a pregnancy is ectopic is through scan. They can do your that they can under you can undergo this transvaginal scan where they put a camera through your VJ to check. They will take it right, take it left, check everything to check. So that is the only way that they can detect if a pregnancy is ectopic or not, is through scan. So from scan, then they can diagnose you if you have an ectopic pregnancy or not. And once you are diagnosed, then you undergo surgery. So the only way to know if a pregnancy is ectopic or not, it's not something you guess. It's not something you stay at home and guess. No, it's not done that way. Because ectopic pregnancy is you have normal symptoms like a normal pregnant woman. You understand? Do we have different type of pregnancies? Yes, of course we do. We have different type of pregnancies. We have cystic pregnancy and other type of pregnancies. Well, our main focus here is ectopic pregnancy. We have other type of pregnancy, but our main focus for today in this topic is ectopic pregnancy. So back to the question you asked me before. Ectopic pregnancy is not something that you just stay at home and experience. It starts no. It's something that you can only detect through scan. You can only detect it through scan because it acts like a normal pregnancy. You miss your period, you test positive, you have your normal pregnancy symptoms, all those dizziness, weakness, vomiting. It shows in ectopic pregnancy. You have those. So how will you know? You won't know. So the best way to know is through scan. That's why it is advisable. Don't wait till you are 10 weeks pregnant, 12 weeks pregnant, 8 weeks. Once you are 5 weeks pregnant, go for checkup. No, just one type. It's called only ectopic pregnancy. We don't have different type of ectopic pregnancy. Just that ectopic pregnancy can occur in the tubes. It can occur rarely. In fact, 90% occurs in your tubes. You understand? It can occur in your ovaries. Rarely, this is rare cases that an ectopic pregnancy occurs implant in your ovaries. It can implant in your cervix. It can implant in your abdominal cavities. That's your liver. This abdominal cavity. That's your liver, your stomach. That is rare cases. You understand? But 90% of time, ectopic pregnancy happens in your tubes. That is why it is called tubular pregnancy, because it occurs majorly in your tubes. But it can happen in other parts outside the womb, but in rare cases. So we don't have different type of ectopic pregnancy. We only have one ectopic pregnancy, just that it can implant not just your tube. Sometimes it can implant outside your tubes. You understand? It can implant your cervix, your ovaries. Just think about a pregnancy being implanted in the ovaries. That means that woman is automatically losing that her ovary. So it can implant your abdominal cavities, your liver, your stomach, and the rest. So the only way to know if you have ectopic pregnancy is just to run a scan and know where the location of the baby is growing. It's not something you can assume on your own. Although one of the signs is pains. When you start having unusual pain, maybe particularly at the right side of your pelvic or maybe at the left side of your pelvic region, that can be tubular, like maybe around your tubular area. Getting pains that are unbearable, pains that make you to even fall out and faint. So I've seen the cases where a woman faints because of she has this ectopic pregnancy, something that is life changing. Once it ruptures, it's 50-50, life or death. So it's best you go for scan and detect it early, and they conduct a test to remove it. So conduct a surgery to remove it. So that is what happens in an ectopic pregnancy. If you are joining my life, do wait to subscribe. Don't just go without subscribing. So if you are joining my life here, maybe coming to my life. I was discussing about ectopic pregnancy, what causes ectopic pregnancy, what is all about this ectopic pregnancy that people is talking about. What are the potential complications one can have if ectopic pregnancy is left untreated? Okay, if an ectopic pregnancy is left untreated, it can result to death. Yes, a woman can die from an ectopic pregnancy because it's life-threatening. If the baby is still in your tube and it's growing and they don't detect it early to remove it, of course, once that thing ruptures and bulks, it can cause internal bleeding, and this can lead to death. So death is one of the, let's say, complications that can result from an ectopic pregnancy. Another complication that can result from an ectopic pregnancy is loss of your tubes, because during the course of surgery you can lose your tubes. That's why you see some women having one tubes instead of two, because our body is designed to have two fallopian tubes. So in a case of ectopic pregnancy, maybe in case of where the doctor is conducting a surgery or operating you to remove that baby that's implanted in your tube, you might end up losing that tube. So they may end up removing the tube entirely, the tubes, the one tube that was affected entirely. Understand? And when that happens, you are left with one tube. You are left with one tube. So that is one of the complications that comes with ectopic pregnancy. Losing your tubes, life, you can lose your life also. Understand? In fact, many women are dying today because of ectopic pregnancy, and it's not something that you prepare yourself for. It's something that happens. It's something that nature just happens. You understand? Previous abortion can cause all these things. Untreated infection can cause it. Untreated PID can cause it. Gonorrhea can cause it. Chlamydia can cause it. So when your scar tissue, all those things result to scar tissue in your tubes, which can result to this ectopic pregnancy. So I don't know if I've answered your question. If you have any question, if you are joining my live, just drop it in the comment section, because I'll be ending this live soon. I'll be ending the live soon. So just the way to subscribe. If you are coming across my video for the first time, here I will make educational content. I just want to discuss one-on-one with my subscribers. So this is one-on-one discussion. You can drop your comment section, a comment in the comment section. So I was talking about ectopic pregnancy, how it happens, and the rest. So one of the complications is death, losing your tubes. And one thing you have to understand is that a woman that has one tube can still get pregnant. And you understand? You can still get pregnant with one tube, because normally is one tube. The egg, you only need one tube to be, during ovulation is one tube that release egg for fertilization to occur. So with one tube you can still conceive, just that, will I say, the chances is more reduced. Unlike when you have two tubes, the chances is more reduced than having just one. But with one tube you can still get pregnant. But just that the past trauma and the rest about ectopic pregnancy can make you being scared to conceive again because of what happened before. So Another way you can bypass this is through IVF. If you have the money, you can option for IVF. So I think some hospitals, but depending on the hospital you go for, some, and I think the average amount for IVF is like 1 point something or maybe 2 point something. So through IVF, you don't need to go through this process of fertilization um, in the tube. They just have to take your ovaries, the sperm, fertilize it, and just implant it inside your woman. Although sometimes IVF fails, you understand, the baby don't implant properly or maybe don't grow. So that's why you hear failed IVF. So even at that, it also have its own risks of, you know, what are the measures that a woman needs to put in place to avoid or minimize having ectopic pregnancy? Okay, one of the measures women have to put in place to avoid or having ectopic pregnancy is to go for a routine checkup. Yes, it had me go for a routine checkup and make sure that you treat any infection you're having. At least do the ones that you can do on your own, that the ones you can be able to do for yourself, because sometimes the cause is unknown. It can just happen to anyone without you doing anything. But just do the ones you can do by yourself. Go for a routine checkup. Do a urine MC, high vaginal swab tests. This thing where they take the sample from your vagina and run a test. Do tests on all these check yourself. Maybe if you have chlamydia or gonorrhea, just do the ones you can. Treat any infection you have. Don't just leave infection untreated. Some of you will have infection and you leave it untreated. You take, maybe doctor prescribe drugs for you, and you take, maybe that drug is supposed to last for 7 days or maybe even 10 days, and you drank maybe 5 days. Maybe the symptom stops and you stop taking the drugs. You're just abusing the drugs like that. It's not done that way. Once they give you any drugs to treat infection, whether be staph or whatever, make sure that you finish that medication. Treat yourself complete. You understand? Treat yourself complete so that you can reduce risks of having all these issues. And if maybe I've heard of something like endometriosis can also result to this ectopic pregnancy. So that's it. It's 1 hour already. I need to go. So I hope you have you gained something today about ectopic pregnancy. Do wait to subscribe. Bye.